In the DMV High School sports scene, my guest is known by her alter ego at Sports Mom DMV. However, her service to the community goes much farther than media. As the president and CEO of March of Dimes, my guest advocates for the health of all moms and babies, no matter their age, socioeconomic background, or demographics. Joining me now is Miss Stacey D. Stewart. Miss Stacey, what's going on?
How you doing, Chris? It's great to see you.
Absolutely, I'm doing awesome. Good to see you too. Everything going well?
Absolutely. It's going well. I always get to be with that sports dude.
I appreciate that. I really do appreciate you coming on. But let's jump right into it. Like I said, we're going to talk about your sports coverage, but the main thing I want to talk with you about is the work that you do with March of Dimes.
Great.
So I just gave kind of a brief overview of what you and your team does. But can you give us more detailed synopsis of what you all do at March of Dimes?
Yeah, so the March of Dimes has been around since 1938, actually. Was founded by President Roosevelt, really in the midst of another pandemic, during the polio pandemic of, decades ago. Very few people, watching this video will probably, I know people have heard about polio, but and a lot of us, most of us, all of us, hopefully, have been vaccinated against polio. But at the time, in the 30s and even before the 30s, the 40s, and even to the 50s, it was a really, really scary virus that spread, and no one knew how. It was very much like coronavirus. It was, things shut down in the summer. Parents didn't let their kids go to the theater, swim in swimming pools. And it affected largely children, although President Roosevelt contracted polio and was paralyzed as a result of it. Fast forward to today, though, what the March Times did at the time was raise a bunch of money, fund the vaccine, the research that led to the vaccine for polio. It basically eliminated polio as an issue in this country. It was one of the greatest public health successes that we've ever experienced. From there, we really just started focusing on other issues affecting babies. And primarily in the last many years, we've been focusing on the issue of premature birth. Now, in the Black community, I don't know how many of others have heard this, but it was always something I used to hear about, the baby came a little early, right? And it was almost kind of normalized. And it has been a little bit normalized. Oh, it came a little early, no problem. Well, guess what? For a lot of kids, it really is a problem. When babies are born too sick, they're often too soon, they're often born too sick, right? Being born prematurely means being born before 37 weeks of pregnancy. And it affects almost 400,000 babies in this country, about 15 million babies around the world. It is one of the leading causes of death for children between the ages of 0 and 5. And that's been a big part of our issue. The last thing I'll just say, Chris, is that as I've been here at the March Times, we've taken the issue of premature birth and infant mortality and looked more holistically at the issue. So one of the things that we know about babies that are born too sick and too soon, born prematurely, is that it often can be the result of the mom not being healthy before she's pregnant, during pregnancy, and the two are very much related. So we now look at the issue of the mom's health and the baby's health. And then the last thing is that when you look at this issue of maternal and infant health in this country, we face, like in a number of different areas, tremendous health disparities. They come because of the way that people of color live in this country. We often live in communities that don't have access to all of the best social services, best housing, best education. All those things affect how we live and therefore affect our health. So the issue of health equity and racial equity in this country is really at the core of the March Times as well. And that's certainly been a part of what I've helped to lead on in the 4 years that I've been the lead and the president of the organization.
Right. And speaking of your tenure, after your tenure, and if I may add, a highly successful tenure with the United Way Worldwide, is when you joined March of Dimes in 2017,
Yes.
correct?
Yes, at the end of 2016, the beginning of 2017, exactly.
So we'll
Yeah.
definitely get to that disparity that you spoke about in a few. But I want to talk about right now kind of what led you to take on this role at March of Dimes, becoming its fifth president.
Right. Well, one of the things that, this is now the third national or global organization that I've served as the president and CEO of. I was president of the Fannie Mae Foundation years ago. We were the largest funder of nonprofit organizations and other philanthropic efforts in DC, and the largest foundation focused on affordable housing across the country. As you mentioned, I went to United Way Worldwide and I became US president of United Way, the largest nonprofit in the country, and now coming to the March of Dimes. And I think one of the things that led me to the March of Dimes really, one is that it has such an important legacy in history, right? I mean, to lead an organization that was founded by a US president is really quite an honor, I think. But
Oh,
this, I think the other thing is that, my dad was a doctor, my father was a physician, and he worked a lot. I grew up in Atlanta, and he worked a lot on, the issues of health equity. He spent a lot of time on desegregating hospitals in the 1960s. He was president of the Atlanta branch of the NAACP in the 60s, while he was also a physician. The issue of racial equity and health equity was always a very important part of my life.
right.
And so the honor of coming to March Downs was really to be able to work on some of these issues, and especially looking at the issues of moms and babies. I'm a mom. I'm sports mom DMV. I'm a mom. I love being a mom. I have two girls that are 18 and 16. And I look at being able to have children and being able to have babies is really a blessing.
Absolutely.
Unfortunately, it's more of a challenge for many families than we even know about. We even acknowledge. There can be a lot of pain that goes along with pregnancy, and especially for women of color. So that the ability to work on that issue just seemed to be really something that matched my personal priorities as well as my professional ones as well.
Kind of like one of those, a culmination of your life's work all in one position, would you say?
Yeah,
I like.
yeah, I would say so. Yeah,
Now, you mentioned how March of Dimes supports moms and babies. So, to kind of speak to, if you can kind of talk about the variety of programs that you all offer. I know
sure.
you all offer some prenatal education, which is just so important, especially for first time moms, even first time dads as well. Um,
Yes.
and some of the things that you all have done globally. If you can kind of speak to some of that variety of programs.
Yeah, well, I think you're right that we do a lot of different things. I think one of the things that we do really well is invest in medical research, and we've done that since the time of polio. We continue to do that. There's still a lot in terms of scientific evidence that we need to build around why some women may not be able to get pregnant, why they may have challenges during their pregnancy. What are some of the issues around? We spent a lot of our history working on birth defects with babies. And so there's a lot of scientific research that we've invested in over many, many years that has been really important and is a big part of what we do. Beyond that, I think one of the big areas that we focus on is around policy change, because frankly, as long as we have in this country, as long as we don't have universal health care, we have people that don't have access to high quality, affordable health care. Um, and then we're going to continue to have a challenge. Women that get on Medicaid when they're pregnant, but then get dropped 60 days after, baby is born, but she may still have, extensive health challenges that need to be, where
Which
she
is
needs
so
follow up
ridiculous.
visits. It doesn't make any sense. And we're the wealthiest country in the world and have some of the worst health outcomes and still don't give universal access to all of our people is really, it's infuriating actually.
Yeah, no, yeah,
And
absolutely.
it is. And then we do a lot of it in terms of programs on our website and with many other programs locally. We do a lot in terms of group prenatal care programs. We have programs in neonatal intensive care units, NICUs, when babies are born prematurely. Most of them end up in a NICU for some period of time. So we have support staff in those NICUs to help those families who are, dealing with a devastating outcome of their baby in a NICU, sometimes for days and weeks and months. We in many NICUs, we'd love to be in every NICU, but we're not quite there yet. But have support staff to help those families navigate that experience. So there's a lot that we do. to even raise the issue of the fact that we do have a maternal and infant health crisis in this country. Chris, we are considered today to be the most dangerous developed nation in the world in which to give birth.
And to be
And
the,
it's,
as you said, the most wealthiest country in the world, to
yes,
have that type of stigma is just unbelievable.
right. And, we have Black women in this country who die at a rate of 3 to 4 times that of white women in this country. We have babies, Black babies that still die at twice the rate that of white babies in this country. We have a lot of progress to make. And I'm focusing on these health disparities because if we could make sure that we dealt with health inequity, we could actually see the overall rates of maternal and infant health improve for everyone in this country. But unless and until we deal with the fact that we have still left too many people of color disadvantaged and without the resources they need to access high quality health and wellness, then we'll continue to see these outcomes. So that's a big part of what I do is try to be an advocate for these issues and to raise the awareness and draw attention to them so that we can actually do something about them.
Absolutely. And that leads me right into my next point that I want to talk with you about. And it's one you just mentioned earlier, the disparity between black moms and black babies and other races. And it's widely known, and everybody listening, you all can definitely research this information yourself. But as Miss Stacey, as you just mentioned, Miss Stacey, black moms have a higher mortality, pre-birth and postpartum mortality rate than any other race. And this actually hits close to home from my wife and I. Back in 2018, our son was born still at 23 weeks. And my wife actually, almost died herself due to complications with the pregnancy. So this hits right close to home for us. But I know that you all over at March of Dimes, as you just mentioned, doing a lot of great work. Um, in addition to some of the things that you just mentioned, can you talk about what you and the team are doing to address the inequalities in maternal and infant health in this country?
Yeah, absolutely. So let me start with the policy things because we have a lot of, I mean, people may not realize this, but we have a lot of issues in the area of public policy that need to get fixed to address
Yeah.
the very issue you're talking about, right? So, so we have, in addition to, not enough women having the kind of coverage and the ability to see doctors during pregnancy. We often have women that sometimes for the first time, it's when they're pregnant, it's the first time they may have seen a doctor because they may not have had coverage before. This happens a lot. And then we still have way too many women that are not going to prenatal visits, and then of course not able to see a doctor after the baby is born. So extending Medicaid coverage is really important. We were big supporters of the Affordable Care Act, which actually made it a requirement that even private healthcare plans
Mhm.
would provide maternity care coverage in their plans when before the affordable care plan and program, Obamacare as we know it,
Mhm.
women didn't have that. Only 12% of private plans actually made maternity coverage a requirement. So there have been a lot of shifts and things that the March Times have been involved in to actually expand access. But let me say this. One of the things that we're also doing in the working with healthcare providers is even if women, especially women that look like me, Black women, go to the doctor, go to a health clinic, we have heard too many times that women of color often don't feel respected, they
Mhm.
don't feel heard,
Yeah.
they don't feel listened to, and they don't feel responded to
Right.
by their healthcare provider. So what we're seeing is a lot of evidence that there is a lot of implicit bias in the healthcare system. So even if you have health insurance, even if you do are covered by Medicaid, that shouldn't mean that you should get uh, any less in terms of quality of care than any other woman.
Absolutely.
And we have got to fight for that. And we've got to make sure that healthcare providers, doctors, nurses, even the front desk folks at clinics recognize that any woman that comes through that door seeking care and needing support, especially if she's pregnant or trying to become pregnant or after her baby is born, deserves the highest quality of care. She deserves to be respected. If she's showing symptoms, she deserves to be listened to and responded to appropriately. Too often, that's not happening for women of color, and that is something that we're dedicated to fix. So we've actually, over the past year, have trained thousands of healthcare providers in
Really?
implicit bias training,
That's
so
incredible.
that they can recognize if they're not responding to women of color for whatever reason,
Hmm.
and begin to address that, and make sure that if their implicit bias does not interfere with high quality healthcare for any woman, especially any woman of color.
And for a women of color, if if they run into a situation where they believe that their doctors, nurses, or who have you, um, are showing any type of racial bias, what are some things that they can do to one protect themselves, and if God forbid the worst happens, to seek recourse? What are some things that they can do?
Yeah. Well, it does mean so. One of the things I just want everyone to understand is if you feel like you're not being treated by your healthcare provider, it is your prerogative and it is your right to demand that you receive the kind of care that you feel that you should receive. You have every right to ask questions and get the appropriate answers, and to ask questions as many times as you need to until you get the answer that you feel like you understand,
Hmm.
right?
Absolutely.
And if someone is not responding to you in that way, you have every right to go to a different provider. I know that there are times when people have raised these issues with hospital administration, and there are more hospitals are now more open to hearing about these issues than ever before. I think one of the other things that you can do is, I mean, certainly the March of Dimes. If we can help women be an advocate, if you can let us know if you're having challenges, and we can help advocate on your behalf, we'd love to do that. Departments of health also locally. So, for example, in DC, there's a DC Department of Health. It's important to let people that are in authority know if you feel like you're not being treated respectfully or not being heard. Um, that is something that we want to make sure that every woman um, feels that her voice matters and understands that her voice matters and her experience matters. And unless we start to listen to the experiences of what women are actually going through, we won't really, make the turn the tide of, some of the outcomes that we're seeing. So we want women to understand that they have a role for self advocacy and letting their voice be heard. We've even seen people put it out on social media,
Yeah.
and sometimes
Yeah.
that can be a very effective way to let people know, hey, this is not the kind of care that I think I deserve, and I want other people to know that of my experience. That often can sometimes be a very powerful way to get your message out.
Oh yeah, especially in this day and age. I think the power of social media
Yeah.
um, goes a long, long way.
Yes.
But thank you so much just for that information right there. Um, I know when me and my wife were going, when we were going through that, the one thing that we didn't know is the type of resources that were out there, during the challenges that led up to the stillborn birth, and then even resources after having, mental dealing with it mentally and stuff like that. So I hope
Yes.
anyone who's watching, especially for my moms, if you're watching, and you didn't get a chance, and you may have missed something that Miss Stacey said, just rewind and then take notes because this is very important information to have. Um, but Miss Stacey, I know that's kind of some deep stuff right there, but
Yeah.
important nonetheless. So let's switch gears a little bit, if you will, and talk about your alter ego at Sports Mom DMV. Now, first, before I say anything, shout out to you. You do a great job
Oh, you're
covering
so
girls
sweet.
high school, especially with all that you have on your plate with March of Dimes. So, how did you get into broadcast media and covering high school girls games?
Well, I boy, it's really kind of interesting. So, first of all, I've got two girls
Hmm.
who played sports, and I have always enjoyed being a part of their sports life. My oldest daughter was a three-sport athlete. My youngest daughter is a lacrosse player, um, and always there's always been a special place in my heart for girl athletes because I've always seen that how much sports um, obviously makes a difference in the lives of all kids. Teaches all kinds of skills that you don't learn sometimes in the classroom and in other areas of your life. And I've always believed that being involved in sports was something really important, both for, those kinds of life skills, but, physical health, and just in a number of different ways. What I've always been passionate about too is how do we elevate, and celebrate girls and
Hmm.
women. And I've been following you. I've been following folks like Who's Mizzou and Real Chad Ricardo, and you guys have always been great in recognizing athletes here in DC. And I just wanted to put a little bit more of a focus on some of the girls who are just amazing
Oh
athletes,
yeah.
and just doing amazing things, and just kind of add to it. I don't have nearly the skill that like you have and others have. I just sort of jumped into it, not even knowing what I was doing. Just being a photographer and taking
Right.
pictures and
You
going to
just wanted
different
to make.
games, just enjoying being and seeing these girls. And I honestly don't even know where I found the time or where find the time to do it. Um, I don't know, but it's just, I guess when you love something, you just do find the time. Um, I met some incredible girls. Tasia Jackson.
Yeah, yeah.
Who graduated from Blue,
Shout out to
was
Tate.
someone. Tasia, amazing. You
Yeah,
know, one of the highest point scorers in DC,
absolutely.
Blue. And when I met her, and it was in just following her on social media that I found out she was also a mom.
Yeah, that's how I found out
It
as well. Yeah.
Right. It blew me away. One
Mhm.
of the best athletes in DC, in the DC basketball scene last year, also a mother, raising a daughter.
Mhm.
She phenomenal,
Yeah.
phenomenal story, right? And that gets repeated all over DC. These girls that are out there grinding on the court, or they're in basketball, they're doing volleyball. I've covered lacrosse, and then they have these incredible stories in their own lives. And I just, one of the things that I would love to be able to do is provide more of a platform for our DC athletes who sometimes, as you know, I mean, I don't know. I mean, the fact that you do what you do has given such a platform for so many of our DC athletes. And I think we're also proud that we have so many great athletes here in this city, in the whole DMV area, and especially in the District of Columbia, that we have a lot to be proud of. We have amazing sports here, and I think that's been the most devastating thing through coronavirus is just seeing sports not being where we would all love it to be. I think we all know why we're here and why it's important to keep everyone safe.
Mhm.
I'm one of these advocates right now. I'm saying, look, if we're going to open the schools back up, we need to open sports back
Yeah,
up.
no doubt
Sports
about
are an important part of these kids' lives, and we cannot continue to just let that not be addressed. And so I'm really hoping we can see some good news on that front pretty soon. But I just got into it because I love it. And if you see me on the basketball court, it's like this little woman with like this camera and whatever, I just give me a shout out or shout me out on social media, Sports Mom DMV, because I always love the good news stories about girl athletes, and I'm always willing to blow you up and give you all the kudos you deserve. So
Oh yeah, no doubt about it. And it's so funny. I know everybody watching can't see it, but she's actually wearing um the one of the WNBA's main colors. I know you guys can't
that's
see. I know you
right.
all can't see that who's listening, but I thought that was just a great touch,
A
especially
little
because
subtle there.
absolutely. Because I feel the same way, especially about girl sports. Because one of my goals, kind of the same as you, is especially I was actually gonna put it into action this year, but with COVID and everything
And
shut.
everything, yeah.
I was gonna start to kind of go even more full force with not just girls basketball, but soccer and volleyball. Because I'm a
Yeah.
huge female sports fan. And I just think it's horrible, especially just look maybe just the WNBA for example, because I just mentioned it. The disparity, kind of, the
Mhm.
disparity in pay and coverage and
Yeah.
respect overall. I just think it's unbelievably ridiculous. So, um,
Yeah.
I'm so glad that you just decided to pick up that camera. I think that's awesome. Now, before I let you go, and I appreciate you so much for joining me, Miss Stacey. I knew when I was putting this podcast together, and I was thinking about what are some stories and information that I can get out through this podcast. You and March of Dimes were one of the first things that popped in my mind, because it is so vital that we get this information to our moms, especially our moms of color, and to our
Yeah.
communities like that. But before I let you go, um, as a president and CEO, I know you talk a lot a lot about goals with your team. So before we land this plane, what are your overall goals, not only with your media coverage but also with March of Dimes?
Yeah. Well, on the March Times front, I do want us to, in the short term, really start to move the needle on seeing some improvements on maternal death and maternal morbidity. So women that die as a result of pregnancy and childbirth, or come close to death, as you experience with your wife, which is so unfortunate. We have 50,000 women that come close to death as a result of pregnancy and childbirth every year, and those numbers are just unacceptable. So I'm hoping that with some of the recent policy wins that we've had, we can start to provide a different level of care. Some work we're doing with the Department of HHS and things like that. I also want to make sure that many more people are aware of this issue and feel empowered to come forward with their experiences, because many people hold these experiences close to them and feel like it's something that they did to cause a miscarriage or a stillborn or a premature birth. And it's really, really important to understand that this is through no fault of a mom's or a dad's or anyone's fault that this happened. We need to understand medically from a scientific basis why things happen. We also need to recognize that there are a lot of factors going on in our lives that may lead to these outcomes. But whatever we can do to change that, that's certainly something I want to do. And we're driving very hard at the March Times to make that happen. With respect to my Sports Mom DMV, I just would like to get back onto the court and see more volleyball, see more basketball, maybe see spring sports this year. That would be terrific, because I cannot bear the thought that we would see a second season of spring sports being canceled, because we had spring sports canceled last year. So we can't do that again this year. But I would also like to, if I can create some more space and time in my life, really go deeper on some of the profiles of some of these girls, because I think, the public would learn a lot from understanding how sports have made a difference in girls' lives, and how even the pathway to college may be a life-changing experience for some of these young women who may not have an experience to do that, or an opportunity to do that otherwise. So I love the fact that I'm not one-dimensional. I can be a business leader and a public health figure and a mom and a big proponent and advocate for girls' sports. Hopefully, I'll have the time and the health to do that for many years to come. So.
Awesome. Well,
and I love keep doing what you're doing, because I get inspired and learn so much from like what you're doing. And I'm very grateful for what you do every day, because you're adding an incredible, valuable service to a lot of people's lives. And maybe we don't take the time to say that enough, Chris, but thank you so much for what you do, for sure.
That means so much, but to God be the glory. I'm just playing my role. I appreciate that so much, Miss Stacey.
Absolutely.
And I also just appreciate you so much for taking the time just to join me and talk a little bit about all the great things that you do, March of Dimes, Sports Mom DMV. So before we get out of here, before I let you go, how can listeners, if anyone wants to connect with you, whether that be with the work you do with March of Dimes or sports or on the broadcast, so how can they get in contact?
Absolutely. So anything March of Dimes you want to know about mom, baby health, pregnancy, all that good stuff, you can go to marchofdimes.org. That's our website. Or reach out to me on my social media. I'm March of Dimes CEO on Instagram and Twitter. I'm also got my public page on Facebook. So find me there. And I'm also Sports Mom DMV on Twitter and on Instagram. Anything sports related, reach out to me there too. And if you get mixed up on which one to reach out to, either March Time CEO or Sports Mom DMV, you can find me there. So Yeah, I'd love to hear from everybody and love to connect.